Good morning and welcome to our Thursday, October 1st COVID-19 briefing. I'm Megan Pearson, your Chief Communications Officer, and today we have Ryan Alsop, our Chief Administrative Officer, Bryn Kerrigan, our Assistant Director of Public Health, and Kim Hernandez, our Lead Epidemiologist. Before I hand it over to Bryn, I'm going to give you an update on our federal mobile site. The site is moving around the county, making sure that we're able to offer testing to as many Kern County residents as possible. And the next few locations we want to share with you today, it's over at the Bakersfield Marriott at 801 Truxton Avenue. It's open from 8 a.m. to 6 p.m. and you can register for a test there at doineedacovid19test.com. Tomorrow it will be at Bakersfield College on October 2nd, again from 8 a.m. to 6 p.m. It'll be at the corner of Haley and University in that lot there, so we encourage you to try that one. It will also be at the Larry E. Ryder Education Center at 2000 K Street on October 5th, which is next Monday. And on the 6th and 7th, it will be at two of our retirement centers, Plaza Towers on the 6th and Pinewood Glen Retirement Community on the 7th. If you go to doineedacovid19test.com and you enter your zip code, it will pull down all of the next 7 days worth of locations and you can register there. Now I'll turn it over to Bryn Kerrigan, our Assistant Director of Public Health.
Good morning. As Megan said, my name is Bryn Kerrigan. I'm the Assistant Director of Kern County Public Health. This morning we're announcing 56 new cases, bringing our total cases in Kern County to 32,184. This morning we're also announcing one additional death, bringing our total deaths to 371. As you are aware, the county has been working with a statistician to determine what information could be appropriately released about those individuals who have passed away from COVID-19, while still ensuring the privacy of the deceased individuals and their families remains protected. The model to make those determinations was finalized and tested using real data by our statistician, resulting in the release of the information you can find on our dashboard as of this morning. The additional demographic data now includes age ranges, race and ethnicity, and sex of the individuals who are reported to have died from COVID from March through September 30th, as well as a group of underlying health conditions that were identified in their medical record or death certificate. In reviewing this data, you will see that 247 of the 371 COVID-related deaths, or 67%, were in individuals who were 65 or older. Since the beginning of the pandemic, the CDC has indicated this age group as more susceptible to severe illness from COVID-19. It is important to note that while our younger population is not as severely impacted, they are still impacted. 12% of deaths occurred in the age group of 18 to 49, and 21% of deaths occurred in 50 to 64-year-olds. Another interesting statistic to note is that while 52.2% of Kern's COVID cases are in females, 58.9% of our COVID deaths are in males. In cases with known race and ethnicity, white residents accounted for 15% of cases, but 28% of the deaths. In comparison, while Hispanic residents account for 71% of cases with known race and ethnicity, they account for 61% of deaths. While there are still a number of cases that have missing race and ethnicity information, this information is important to realize. Furthermore, only 12 or 3% of our local deaths were in individuals with no noted underlying health conditions. This statistics demonstrates the need to keep ourselves as healthy as possible to significantly decrease the likelihood of severe illness and/or death should you contract COVID-19. The largest contributing underlying health conditions are diabetes, hypertension or high blood pressure, and cardiovascular disease. To view this newly added information, please visit our website at kernpublichealth.com. Late yesterday, the state released the health equity metric for the state's blueprint for a safer economy. Kern, classified as a larger county within the state of California, will be measured based on the test positivity rate within the lowest quartile of the Healthy Places Index. What this means is that each county's census tracts have been ranked using the California Healthy Places Index based on socioeconomic conditions, including education, transportation, housing, access to healthcare, amongst others. 25% of those lowest ranking census tracts, or the lowest quartile, must have an aggregate testing positivity rate of 8% or below for the county to progress to the less restrictive Tier 2. Additionally, as a part of this metric, the county must submit a plan defining the use of state grant funding that will be used to interrupt the disease transmission in these areas. This measure goes into effect October 6, 2020, and we are actively working on strategies to address these areas. This change means that Kern will now have to meet the following metrics for 2 consecutive weeks before we can officially move into Tier 2. The first is the adjusted countywide case rate must be 7 per 100,000 population or below. The second is the countywide test positivity rate must be below 8%. And the third is now the lowest quartile aggregate testing positivity rate must be below 8%. As of Tuesday, September 29th, the state announced that Kern County was still in Tier 1, or the purple tier, the most restrictive tier. They reported Kern County had a case rate of 6.6 and an adjusted case rate of 7.3, with a testing positivity of 5.8%. If the state would have reported our lowest quartile testing positivity rate, it would have been at 8.3% on this past Tuesday, according to data that they gave us last night. I mentioned the adjusted case rate, and the case rate is now adjusted by the state based on Kern's average testing rate compared to the median state's testing rate. As of Tuesday, the Kern's average testing rate was 155.3, while the state's median testing rate was 216. While Kern needs 563 more tests per day to meet the state's median testing rate and not experience the artificial adjustment to our case rate, it is important to remember that testing is also a very important resource to slow the transmission of this disease in our community by identifying infected individuals who can be isolated. For more information on accessing testing, please visit the county's website at kerncounty.com. This past Monday, September 28th, the state released additional guidance for outdoor playgrounds and outdoor recreational facilities, allowing them to reopen with restrictions statewide. We are actively working with our local parks and recreation departments and districts throughout Kern on implementation of this guidance. I'd like to close my comments this morning by encouraging our residents to obtain a flu shot. When the Surgeon General visited Kern a couple of weeks ago, he stated this is likely the most important flu season of our lifetime because of the COVID-19 pandemic. In an effort to prevent what the state is referring to as a twin-demic of COVID-19 and influenza, getting a flu shot is an easy, free, and safe action we can take to keep ourselves and our loved ones healthy during the pandemic and to preserve our healthcare resources. Our department is offering free flu vaccinations. For more information on when and where to obtain your free flu shot, please visit our website at kernpublichealth.com. Thank you.
Good morning. Today in Kern County, we've tested 195,000 people for COVID-19 to date. 32,184 residents have tested positive to date. As Ms. Kerrigan mentioned, 56 new cases are being reported today. Of this 32,184 positive tests to date, 31,735, or nearly 99%, are either fully recovered or presumed fully recovered or are isolated and recovering at home, treating their symptoms on their own. 78 people, as of today, are currently receiving some form of care related to COVID-19 in area hospitals. A few words on some county programs. The county and participating cities are offering free dial-a-ride public transit services for residents to receive free COVID-19 testing in an effort to reduce transportation barriers in some of our rural areas of the county. This program is currently being offered in Delano, Taft, Rosamond, Kern River Valley, Lamont, and the Tehachapi area. Again, there's no cost for the COVID-19 test and no cost for the transportation to and from the testing site. If in these areas and you're interested, please call your Dial-A-Ride transit provider for more info on how you can get picked up and driven for free to take a quick, easy, free test for COVID-19. Kern Recovers nonprofit grant program is currently open and accepting applications. This is a partnership, again, between the city and county. The city has put in $2 million. The county has put in $1 million for a total of $3 million in available grants for area nonprofits. Grants are given away in the $5,000, $10,000, and $20,000 allocations. And if you are interested and you are a nonprofit, we encourage you to apply online. It's easy to do. Take advantage of this program at kerncounty.com. Free PPE, personal protective equipment, is still available to local small businesses under the Kern Recovers PPE support program. To date, we have provided this equipment to 1,927 businesses who are supporting 46,168 employees across the county. We've distributed over 36,976 boxes of masks, the 50 count, 52,892 bottles of hand sanitizer, 5,108 boxes of gloves, 100 count, and 50,896 disinfectant wipes. For more information on how you, as a small business, can access this equipment for free, no cost to you, please visit kerncounty.com. We have delivered 1.4 million face masks to Kern County's most at-risk residents through almost a dozen different programs administered by Community Action Partnership of Kern, or CAPK. These are programs like WIC and the food banks and senior programs, et cetera. We are providing another 1.4 million face masks this week for a total of 2.8 million face masks to these vulnerable populations by the end of this week. Housing for the Harvest program, which was announced just about a week ago, is currently underway and available to provide isolation for farm workers and food processing workers who are exposed or who are recovering from COVID-19. This is a very important program. We're wanting people to take advantage of this, and there's more info on that program by calling 211. 211. And lastly, the county and city are offering rental and mortgage assistance to those most in need here in our community. If you are interested in getting this mortgage and rental assistance, you can call 211 for that information and how you contact and apply for that assistance. Again, call 211. A couple of notes on the governor's tiers. Ms. Kerrigan spoke about them briefly. Here, I wanted to hit them myself. Tuesday, the state announced that Kern County continues to remain in this purple tier, or the widespread tier of the governor's blueprint for a safer economy. The state, as you have been told, has selected each Tuesday as their official day for all county information related to moving through this tier system. When that information is updated and announced to the public, they're doing that every Tuesday. With that said, today, Kern County is meeting all the state's requirements to move into the next tier, the red tier. In fact, we were meeting red tier requirements yesterday. Today, Kern County has a case positivity rate of 5.8 per 100,000 people and a state-adjusted case rate of 6.5 per 100,000 people. The state's goal for this metric, as Ms. Kerrigan talked about, is to be below or at or below 7 for 2 consecutive weeks. So that number is good today. Today, our testing positivity rate is 5.7%. The state's goal for this metric is to be below 8% for 2 consecutive weeks. That metric is good today. Today, in this new criteria that was just announced by the administration quietly yesterday, the lowest health places index quartile testing positivity rate, which now counties are being judged and being required to meet. This is in line with Ms. Kerrigan's earlier comments. Today, we are at 6.4% on that requirement. The state's goal for this new metric is to be at 8 or below. If this trend continues and we are able to sustain these increasingly lower rates across each of these metrics, the county will officially report them, or the state will officially report them on Tuesday of next week, and the 2-week period for transitioning into a less restrictive tier begins. Again, moving into the next tier allows increased indoor activity for our restaurants, our gyms, our places of worship, our schools, among other activities in our community. We need to continue to work as a community to decrease our case rate and testing positivity rate. I want to thank, and I think our public health team wants to join me in thanking all of you for doing everything that you can to help achieve these objectives, knowing you're all doing so under extremely challenging times, difficult circumstances, moving forward in an effort to sustain the trajectory that we find ourselves on here in Kern County. We'll be focusing on community partnerships, community-based partnerships, our distribution of PPE, public education, and increasing testing throughout our community, particularly in those areas of our community with uniquely high positivity rates. This will be the mainspring of our exertions going forward, given the changes that have been made and applied by the state, given the criteria and the metrics that the state is holding our county and other counties accountable to meet in order to get more business activity going, in order to get more children back in the classroom. Increased testing in our community is essential, and we appreciate everybody's attention and efforts in this area, everybody that we're partnering with. Thank you, KGET and Telemundo, for your hosting of a free testing site yesterday. Thank you to the Marriott today for hosting a free testing site at your location. Thank you, BC, for stepping up and hosting multiple free testing sites up at the college. We appreciate it. We look forward to working with everyone in our community to continue this going forward. And with that, we will answer questions.
Thank you, Ryan. Okay, as usual, we'll go down the list that was provided to our media outlets. We ask that you make your first initial question, and then we'll come back at the end for follow-ups. This allows your counterparts who have other assignments on their desk to get off the line and moving along. So with that, our first outlet is Kern Soul. I believe we have Celeste on the line. Remember, it's *6 to unmute. Okay, our next outlet is Mojave Desert News. I believe we have Jack on the line. Any questions? Okay, our next outlet is Valley Public Radio. Carrie Klein, any questions?
Yes, I do. Good morning.
Good morning.
I was wondering, okay, so now that we have this new metric, this health equity metric, do you think that, well, basically, how fragile is this metric? You know, there's always a possibility that Kern County could regress, could dip back into the purple tier with some of these other metrics if certain things change. Like, what would need to change in order for that metric to you know, rise too high above this threshold? And do you think that Kern County is at risk of that?
Okay, Carrie, I'm going to restate your question. Sorry, the audio is a little low, so it's kind of hard to hear you. I think what you're asking
Sure.
is I think I heard you say, how fragile is that last metric, the healthy?
Yes.
Okay. We'll have Bryn Kerrigan respond. Give us 1 second.
Good morning. So the health equity metric was designed to be used as a metric in order for a county to move to a less restrictive tier. However, it is explicitly stated in that metric that it will not be used to force a county to backslide into a more restrictive tier if that's the only metric that the county is no longer meeting.
Okay, got it. Thank you.
I'm going to go back really quickly to Mojave Desert News. We understand you unmuted. Just want to make sure you didn't have any questions. Okay. Our next outlet is Channel 29. Tim Johns, any questions?
No questions today.
Thank you.
Hi guys, Tim here from Channel 29. Thanks for taking the time for the question. So I just have a follow-up on the new tier system as well. So from my understanding, and correct me if I'm wrong, this means it'll make it a little bit easier for us to go into tier number 2 from where we were at even a week or two ago. I know previously the state was adjusting our rates because our testing per capita was lower than they would like. Is that fair? And are we cautiously optimistic that, in a week or two's time, we will be able to move into the red tier now?
We're going to have Bryn respond. Tim.
Thank you.
Good morning, Tim. If I understand your question correctly, it does not change the fact that there's still an adjustment for our case rate based on testing volumes that are occurring within a county. So that has not changed.
Okay. So we still need to make sure our testing levels are more elevated than they have been in previous weeks then?
Absolutely.
Okay. And my final question is, thankfully, our numbers seem to be continuing to decline. I know a few weeks ago we were talking about worrying about a possible Labor Day spike. That doesn't seem to have materialized. So have we avoided that? And are we still expecting to see a potential increase as we get into these colder months? I know Mr. Constantine had said we expect our peak sometime early next year. So are we expecting this lull in numbers to go back up then?
So Tim, I think what you're asking is specific to the Labor Day possible spike and whether or not we did see anything, and then whether or not we expect to see anything related to flu season.
Yes, exactly.
Okay, we'll have Bryn respond.
Good morning. So,
Good morning.
fantastic news is we did not see a significant increase in our cases due to Labor Day. We saw a slight increase, but not a significant increase. So we're grateful for our community that they implemented all those mitigation measures. The modeling has not changed. It still shows that COVID-19 is expected to continue on the increase and peak in the later winter months. Which is why we're trying to be so proactive about with the flu season and the mitigation measures for COVID. So we just continue to encourage our residents to continue with those mitigation measures, wearing a mask, washing your hands, social distancing, not gathering, and that will help us both prevent the flu and continue to see decreases in our COVID-19 numbers.
Thank you, guys.
Okay, do we have anyone from Channel 17 on the line? Okay, Telemundo, anyone on the line? Okay, the Bakersfield Californian. Sam, any questions?
Yes, Megan. How are you doing today? I've just got one question about the demographics that were released this morning. I was wondering, are these these fall in line with what the health department was expected, or was there anything in there that sort of bucked the trend of what they're seeing nationally?
Thanks for the question, Sam. You're just asking if we the numbers that we've released now are what we expected, and if they're following a trend nationally, correct?
Yeah.
Okay, we'll have Bryn or Kim respond. Give us just 1 second. I think they're actually reviewing some data really quickly.
Okay.
It'll be Kim.
Hi, Sam. Good morning. At the health department, we have been following and tracking the deaths all along. We just had not had the go ahead to be able to provide it publicly. So nothing that we see in our death dashboard, the data dashboard, is surprising to us at Public Health. We've been watching it closely as it's evolved over time. It tends to fall in line with what we see statewide. There aren't big dramatic differences, but it is something for us to hopefully give you more information and to let people know, that just as expected, we see a lot of deaths in people over the age of 65. However, we still see deaths in people between 18 and 49, and so that's something we want to bring to everybody's attention. We expected to see a large majority of our cases to have underlying conditions. However, there were still 12 deaths in 12 people who, as far as we can tell in their medical records, and that they did not have any of those underlying conditions. And so we want to make sure that our community is aware. CDC has said all along that there are certain things that put us at high risk of severe illness and death, and our data falls pretty much in general in line with that. But we want to remind people that even if you don't have any of those high risk factors in your life that you know about, that COVID can still be very serious. And we want everyone to take every precaution they can to avoid catching it, to avoid transmitting it to others, and to keep our community safe. Thanks, Sam.
Okay, thank you very much.
Our next outlet is Channel 23. I believe we have Tori on the line. Any questions?
Good morning. Thank you for taking this question. So we are wondering why you guys decided to release the additional data today as compared to before when we asked.
Thanks for the question, Tori. I think we're going to have Bryn respond. Give us 1 second.
Good morning, Tori. As we've been reporting for a number of weeks, we've been working very closely with the statistician to determine how we could safely and appropriately release this information. We did get the finalized model, and it was tested on real data this week. And so we finally got the go-ahead to go ahead and release this information in a safe and appropriate manner.
Okay, and so I'm looking at the additional data and the death demographics, and as far as ethnicity goes, it's now showing the people who have, just to clarify, is this the people who have died due to COVID-19, or is it the people who have had underlying conditions? Because it's a little misleading because it says underlying medical conditions. Each person may have multiple conditions, and then it has the pie charts of each ethnicity. So I just want to be clear in our reporting that the pie charts included on this new data dashboard, this additional data, is not including the ethnicities of those who died, or it is.
Thanks, Tori. We'll have Kim respond.
Hi, Tori. So if you are on our regular data dashboard, there is a link next to the number of deaths that we have on the main dashboard that takes you to another dashboard that looks specifically at all of the residents who have unfortunately died from COVID-19. So if we're talking about the same thing, when you're looking at that list of underlying conditions, those are underlying conditions that have been identified in people who have died. What is important to note about the underlying conditions is that some patients will have multiple underlying conditions. So if you add up all of those bar charts, they don't equal 371. It's something higher than that because a patient may have both diabetes and hypertension or have several of those underlying conditions. So what you see on that specific page is specific to the number, to the patients in our county who have died. So in each particular chart, when you add that all up, it should come out to that 371.
Okay, and that would include, again, the pie chart right below that's displaying the ethnicities. Those are the people who have died based off ethnicity.
Yes, ma'am.
Cool. Thank you.
That was our last outlet, so I'm going to go back up to the top and just breeze through and see if we have any follow-up questions. Kern Soul, any follow-up questions? Mojave Desert News, Valley Public Radio, Channel 29, Channel 17, Telemundo, the Bakersfield Californian, and Channel 23. Okay, with that, we're going to close up. Thank you for watching today, and we'll see you next week.